welcome you in the national webinar series. This series is about the breast cancer. Today the second in series, and this is about the breast cancer. No, I thought you were coming.
Have you started?
Yes, sir. I was thinking after that.
What happened?
Okay. So this is a webinar series which is about the breast cancer awareness and prevention. For this, we have our key speaker, Dr. Anita Khukar. She is Director, Professor, and Head in Department of Community Medicine in Bardhaman Mahavir Medical College and Safdarjung Hospital. Before that, I would request Dr. L. Swasti Charan, Additional Director, DDG and Director EMR, to give his keynote address for these specific issues. Thank you, sir.
Thank you, Sikha, and good afternoon, friends. In our series of national webinars on various components of NCDs, today we are embarking on a very important and very interesting component of cancer. Breast cancer and awareness and prevention is the topic for today's webinar, and we are happy that we have many state nodal officers, medical officers at the PAC, CAC, district hospital, and also the nursing staff and many members of professional bodies are here today. Friends, we all know the burden of cancer in this country. We won't go into the details, but we also know that there are various causes of cancer. So particularly before we go to the breast cancer, we know that overall the causes of cancers are very much related to our lifestyle diseases, particularly tobacco, alcohol, obesity, unhealthy diets, etc., and also role of infections and hormones and the overall pollution that we all go through in our lifestyle. We have made some efforts in this program. Our program focuses more on health promotion of healthy living and also trying to screen people before they actually develop the common NCDs, particularly the three cancers. And breast cancer, along with oral cancer and cervical cancers, are there in the screening program. And by this screening program, we are trying to detect those people who are already having cancer, and we are not leaving them undetected to develop into full-blown cancer. To do this, we have set up a very good mechanism in this country, and the district hospitals, the NCD clinics, and the community health center, the NCD clinics and the medical officer at the MOP, PAC are the focal points where we have the doctor. Before that, we have the ASHA talking to the household owners, the people at the household, and also the ANMs and the CHO at the Ayushman Arogya Mandir. Along with that, in the hierarchy, we have set up 19 state cancer institutes and 20 tertiary cancer care centers. These are centers which are supposed to provide comprehensive care for cancer. Along with this, we also have various medical colleges to the tune of 730 in the country, and also many institute of national importance, many AIMS and tertiary care centers which has come up in the country providing cancer care. But we all have to agree that we do not want the emphasis only on the treatment and management of cancer. Some of them may be at the very last stage. We will continue to take care of them in these centers. But what we need to focus is how we can prevent these from happening. And if they have happened, how do we detect them at the earliest possible so that we do not have catastrophic effects of a very advanced cancer that we would see later on in the patient's life. With this in the background, I wish each one of you success here. And this is a very popular webinar series from the NCD division of the ministry. And I'm happy that we have our eminent speaker, Dr. Anita from our Safdarjung Hospital, and we are excited to listen to ma'am, and also I would request my group to see my team here to see what are the questions which come up in the chat, and also try to answer them from here. Now, with this, let's have a very exciting national webinar series for today. Thank you very much.
Thank you very much, sir. for giving the overview of the NPNCT program and the provision under the program for cancer awareness and the services available. Now, I would request Dr. Anita Khokar, Director, Professor, and Head Community Medicine, to kindly take over the session. Madam has done a pioneer work in breast cancer awareness. So, ma'am, because we under the program we are working and we look for the insights. Over to you, ma'am.
Yeah. Good afternoon. Am I audible to all?
Yes, ma'am, you are audible properly.
All right. Thank you for the audio check. Good afternoon. Namaskar. Thank you so very much, Dr. Swasti Charan, Additional DDG and Director EMR, and Dr. Shikha Vardhan for having me here today. And thank you to all the participants who've joined in. I can see over 808 participants who've joined in, which is a good number. Thank you very much. So topic which has been given to me for the day is breast cancer awareness and prevention. And I'm going to touch upon why there's a need for breast cancer awareness in today's date and age. What does it entail and what can we do for prevention? So this is the first slide I would like to show. Till about a few years back, these are all the celebrities from big and small screens from India. Till about a few years back, there were only two leading ladies I could talk about when I used to talk to women, to show them Indian faces who suffered from breast cancer. But over the past 3-4 years, so many new faces have been added to the picture, showing probably that the cases are going up, and also showing probably that people want to talk about it more and more, which is a good sign that they're coming out and talking about it. So here we have the next slide where we have a lot of international figures. What we see from this particular slide is that no matter what your profession is, you could be a wife of a president, or you could be a singer, you could be a TV host, or you could be a very famous sports star, you could still get breast cancer. And West is the place where the leading, where a lot of leaders were already talking about it, unlike our country, where people started talking about it and coming out in the open only a few years back. And till now, we've been talking about breast cancer, and it's been represented by a pink ribbon. But many countries are now talking about including men also in this campaign, and they have made the ribbon blue and half pink, because men get it too, is the message that they're giving out to the people. So we do get cases, but very rare. For every 100 cases which happen in women, there's one case which occurs in a male. Okay, so why do we need to talk about awareness? Let's look at a few key statistics over here. This is the Globocam figure for the year 2024, which I've taken as the latest figure, although the figure is for 22, but I've taken it just 2 days back. Now, what do we see over here is, overall, the incidence of breast cancer is at number 2. So we are getting about 22 lakh new cases getting reported every year. And there are about 6.6 lakh deaths happening every year from breast cancer. Now, what we see is, although breast cancer is at number 2 when we're talking about the new cases getting reported, but the mortality, it is at number 4, is because a lot of other countries are very good with screening and treatment modalities. Now, let's look at the picture for our country. When we look at our data for the year 2022, what do we see? Breast cancer is the number 1 form of cancer amongst women. That's accounting for about 1.92 lakh cases, which is about 26.66% of the total cases. So it's now clearly the number 1 form of cancer in women. But when we look at the data for both the sexes, what do we see? It's still the number 1 form of cancer. That is, breast over here is the number 1 form of cancer when we put together both men and women. What does this mean? That women are getting affected majorly by breast cancer. So we need to think of strategies to create more awareness amongst the women population, and also more of treatment facilities, keeping the women patients in mind. And when the lady of the house suffers, it's the whole household which suffers. We have to take that also into account. It's the children who suffer, it's the husband who suffer, plus the dependent in-laws and others, and the elderly of the house. So this is the data which I showed For Globocan, I said 1.92 lakh new cases is what we are reporting. 50 to 70, this is sad. 50 to 70% of the women, they present to a healthcare facility once the disease is already in stage 3 and 4, which is the advanced form of cancer. And out of these 1.92 new cases, 1.92 lakh new cases which are getting reported, about 90 of them succumb to the disease. They don't even survive. The main reason is that they're reporting in late to the hospital. And we need to downstage breast cancer. 45% of the new cases and 54% of the annual deaths are also occurring in the developing countries. And India happens to be a developing country. And when we look at the survival rate, they are low in the low income country. Survival rate is only 40%. Again, the reason is that the patients are coming in late. Our screening program is not in place. Our treatment modalities are not as good as compared to middle income and higher income countries. And when we look at the screening rates for breast cancer in India, obviously we are really not proud of these figures. It's 0.9% is the figure of women who have ever undergone a breast examination for breast cancer. NFHS data 5, it's 0.9%. So this is extremely low for a country. That's a cause of concern. So what can we do for screening for breast cancer? So when we are saying screening, we are trying to apply some sort of a test to an apparently healthy person to figure out if she has any signs and symptoms of a particular condition. And here we're talking about breast cancer. So breast self-examination is number one, which comes to our mind. Second is a clinical breast examination, which a doctor or a trained healthcare professional does on a lady. And third is a mammography. Now for our country, I will put breast self-examination at number one because awareness is poor and ignorance is very high. And the socio-cultural milieu of our country is such that people do not like to talk about breast because it's a private part of the body. Now breast self-examination is a term which we use when a lady looks at her breast. She does a visual inspection as well as she touches the breast and examines her breast every month. Whereas now a lot of agencies have started using this term called breast awareness. What this means is when a lady knows the normal look and feel of the breast. Now, normal look and feel of the breast, how will a person know if she does not perform a breast self-examination? So what I would say is that this is old wine in a new bottle. And for a low income country like India, we have to still talk in terms of breast self-examination. What is this? It's just a screening technique by which a lady herself can examine her breast and the chest area, including the armpit, with the help of her own fingers. So this is self-examination here. What is the need for doing this? What has been observed is that on average, a lady who finds the lump in the breast accidentally while having a bath or let's say while changing her clothes, the size of the lump is fairly big, 3.6 centimeters. And when a lady does a regular breast self-examination, then the lump size can be 2 centimeters or even less. That means we are downstaging the disease to stage 1. That is possible. So how do we recognize breast cancer? These symptoms need to be told to each and every person because we get a lot of people who say, that I had a lump. It was a small lump. There was no pain, so I did not bother at all. Please, this needs to be, taken with this particular symptom needs to be taken seriously, that if there is a lump in the breast and it doesn't have pain, that needs to be investigated and not to be neglected. So any lump or mass in the breast or the armpit, yes, that could be a sign of a breast cancer. Any change in the shape and size of the breast from the usual for the lady, yes, that is also a sign of breast cancer. Discharge of blood from a nipple, especially if from one single nipple, and if it is a spontaneous discharge, that could be a very sinister sign of breast cancer. Any change in the skin, whether it leads to dimpling or orange skin peel kind of appearance or retraction of the nipple, that could also be a sign of breast cancer. Over here at the top, we have normal breasts. So there might be some difference in the size and shape of the two breasts. And here we have various types of lumps which are there, various degrees of lumps which are there. Here we see the asymmetry in the size of the breast. This one is bigger here, this one is bigger here. Here the nipple has gone and it's inverted. Here we see a tumor which is tugging on the skin, and there's a clear-cut dimpling of the skin. Probably there's a growth inside. What else do we see? We see a difference in the size of the two breasts. This one is inflamed and it's looking shiny. There is some sort of an inflammation here. What do we see here? Dimpling of the skin is there. Again, the dimpling of the skin is there. Again, small little dimpling. So a sign as small as this could be a sign of breast cancer, which a lady can actually pick up by examining her breast on a monthly basis. The nipple, which is usually towards the outside, has gone in or has become inverted. And here we see a difference in the size. In fact, this one is red. I'm not sure if you can appreciate from a distance. Yes, here you can make out that this one is inflamed and it has started to look like a orange peel skin. This is the orange peel skin kind of breast. These are all various types of manifestations of breast cancer. Here on the right side, what we see is nipple and the areola. They have become thick and red. There's inflammation here. And here we see spontaneous discharge of blood from one of the breasts. These could be some of the common signs which a lady can pick up and come to the hospital at the earliest. When should one perform a breast self-examination? It should be done once in a month, not more than that. What is the right time of doing it? Is at the end of the menstrual flow is the right time of doing it, because that is when the breasts are least tender to touch. And for women who do not menstruate, they can do it on the same date every month. For example, we have this calendar here. Period starts from 24th on 22nd of April, finishes on 26th. When does she perform? On the 7th day from start of her periods. That is the best time. When does she start her when does she do her breast self-examination? On 14th, she's starting the periods. The best time would be on the 7th day from start of her period. That's the best time. For people who do not menstruate, what do? They can remember any one fixed date and do it on the same day, because they do not have any menstrual fluctuations, like on the 7th, 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 and 7th. That is good enough. For women who are breastfeeding, they should breastfeed the child, empty out the breast, and then do the breast self-examination. So there are two parts of breast self-examination. One is looking in front of the mirror, and other is feeling or palpating with the help of our own fingers. Now, these are the four positions in which she should be actually looking at a breast and looking out for any abnormalities. 4 different positions are required because the configuration of the breast changes in each one of them. So in case there are any small little subtle changes, they can be picked up. Arms by the side, arms raised, then moving from one side to another, putting both the hands on the waist and applying pressure, making the chest muscles tight, and bending forwards, and then looking at the breast and looking for any of those changes, whether there is any lump, any teething is there, or any kind of discoloration is there, or any kind of discharge is there, any change in the shape of the breast. Those are the things which she's supposed to look at. Second part of the breast self-examination is that of feeling or lying down. Now, this position is considered to be the best is because we know that the breast is a hemispherical or a conical kind of a structure. And if you would like to feel the full thickness of the breast, the lady should lie down flat. So what she has to do is, let's say she's examining the right side of the breast first. She'll put a pillow under the right shoulder and extend the arm out at 90 degrees. And once she does this, the breast falls flat onto the chest. It becomes absolutely flat, and one can feel the whole thickness of the breast. And after that, the examination starts. Boundary walls I have highlighted over here. This is the area of the breast which needs to be examined, and also a portion which is going into the armpit. We will not leave that portion out. So how do we do it? With the help of the 3 fingers. So if it is the left breast, it's the right hand, middle 3 fingers. If it is the right breast, it's the left hand, middle 3 fingers. And the flat portion of the pad has to be used like highlighted over here. The reason is because that is the most sensitive part of our fingers. So lady will make 3 dimes, 3 circles at one point, roughly about the size of 1 rupee coin. So light pressure, she'll apply only the topmost skin will move. Medium pressure, she'll go midway into the tissue. And when she applies deep pressure, she should be able to feel her ribs or the bones on the verge of pain. So light pressure, medium pressure, and deep pressure. 3 circles at one spot, roughly about the size of 1 rupee coin, so that the full thickness of the breast is examined. This is what she needs to do. And what is the pattern which should be followed? This is seen to be the best pattern, that is the vertical strip pattern. She can start the examination from middle of the axilla and go on making 3, she can go on palpating and moving one finger width downwards. So up and down, up and down, up and down, till she reaches this point, roughly about 14 to 16 strips per breast she will have to make. And once she reaches this end point, she's covered 1/2 of the breast. What will she do? She will flex the arm and put her hand into the axilla and examine the axilla. So that is very important that she examines the axilla, because 50% of all the problems are happening under the axilla. That is the area. And then finally, if there is any discharge, especially from one side of blood, that needs to be noted. So this is how a lady can do it. May need some time, initially to practice, but she can actually do it. Another thing is breast self-examination is one thing which needs to be done every month. All those girls who are more than 18 years of age, they can start doing it, and right till the end, this needs to be done. Second modality I mentioned was a clinical breast examination. That can be done by a trained doctor or any paramedical professional, or like it has been mentioned in a program that clinical breast examination should be done for all women between 30 to 65 years of age once in every 5 years. So that is a separate modality, clinical breast examination. And third part is mammogram. Now, mammogram is nothing but an X-ray of the breast, which is taken in 2 positions. So 2 views are taken per breast. Screening mammogram and diagnostic mammograms are 2 separate entities. And mammogram is one thing which is not available throughout the country. And this is one modality which cannot be used for women less than 40 years of age, is because their breasts are dense. And there is some sort of a exposure to radiation also. So all those women, although we do not have a guideline for a country as such for screening mammography, but starting at the age of 40 years, screening mammography should be started by all those who can afford and who have access. Baseline mammogram at the age of 40, and then once every 2 years, they should go for a screening mammogram. What about younger patients who have some sort of a breast tissue? They can go in for the breast ultrasound here. And this is good for detecting all those conditions in which there could be a fluid like a cyst, especially in the younger patients, those in their 30s. And then if there is a doubt of why needle aspiration is done, a needle is put, we take out the fluid, or we take out a few cells and we try and check that. And finally, this is the gold standard. A breast biopsy is done. If there is a growth and we're not too sure what it is, this is the one which will tell us, yes, what is the nature of that particular tumor or the growth inside. So that is breast biopsy. I'm just giving these names so that we know if somebody has something, what are the modalities that we need at various levels. Next, let's come to, can we prevent breast cancer? If we feel that the breast cancer should not occur to a woman at all, is this even possible? Now, my answer would be that's not entirely in our hand. It's not in our control. The reason is that we really do not know about half of the risk factors for breast cancer. There's some factors that we know about, out of which some are modifiable, and there's certain others which are not even modifiable. So we really can't do much about that. For example, being a female is the highest risk factor. There's nothing much we can do about that. Getting older by the day is something else we really can't do much about. As the age increases, so does the incidence of most of the cancers. And there's nothing we can do about that. Then menstruation and menopause. This is what we've seen, that over the years that the age of menarche has gone down. So if the age of menarche goes below 12 years, and if the age of menopause goes beyond 55 years, there's likelihood of getting a breast cancer. The chances are higher because of the cumulative effect of estrogen exposure in these women, because they're having those many more menstrual cycles. Family history. Now, this is a very common myth, I don't have a family history and I will never develop breast cancer. No, it doesn't happen like that. Family history is important. Family history is one of the factors and we need to look at it, and it's not the only factor. If it is there, the disease will be there, otherwise it will not be there. Here, what is important is the family history on both the sides need to be taken, for that of the father as well as the mother. And if more number of first degree relatives have breast cancer, then your chances of breast cancer go up. That of a lady, they go up. Breast cancer is purely genetic. If I do not have the genes, I will not get the cancer. No, it's not like that. Only 5 to 10% of the breast cancer cases are purely genetic in nature. In 90% of them, there will be no involvement of genes. Then certain partially modifiable factors we have. Having the first child after 30 years of age. Say, having one full-term pregnancy protects us against breast cancer. We know as the careers have taken up for girls and as the age of marriage is going up, the age of having the first child has also gone up. There are many couples, especially in the urban areas, who do not want to have a child or who do not breastfeed for as long as desired. So, yes, these are some of the risk factors which are contributing to increase in the cases of breast cancer. If a lady has had breast cancer in one breast, that's a risk factor. If she has had carcinoma in situ, that's also a risk factor. And especially if there's a history of ovarian cancer also in the family, that is a high risk factor for breast cancer because the genetic mutations for both are the same. Which are the modifiable factors? We call them modifiable, but for some of us, very difficult to do this also, is to control our weight. Obesity is, again, something which is associated with breast cancer. So, if we are talking about obesity, we'll be also talking about physical activity and diet like we do for most of the non-communicable diseases. Now, physical activity of half an hour every day, at least 5 times a minute, is something which should be practiced by all, irrespective of your size, whether you're thin or obese. This needs to be done. It helps in regulating the level of estrogen also. Plus, it helps in controlling the obesity. So physical exercise is absolutely a must. Second is the diet, do's and don'ts. Do's and don'ts I'll be talking about. Now in do's, if we consume fruits and vegetables, like we say, about 400 grams in a day, they provide us with good amount of antioxidants and they are protective against cancers and other non-communicable diseases also. And oils, if we have to use plant-based oils, are considered to be better. What about the don'ts? Now, here we have all our favorite food items which are there in a kitty party, or it could be there in any office meeting also, or a birthday party. What is the problem with these food items is that they have very high amount of trans fatty acid. And trans fatty acid is definitely associated with breast cancer. Trans fatty acids are hydrogenated. They're added to a particular food item to increase its shelf life. So does that mean that everything is wrong with the Western diet and the Indian diet is all fine? No, all our favorite food items are in here also. How does this fellow who's sitting here make, let's say, pakoras for you, or how does he make gulab jamun for you? How does he fry them? He will take a kadhai, put some oil, and he'll fry them, right? And the oil which is there is all black in color, and the black smoke is coming out from it. So that is the oil which is carcinogenic. And all our favorite food items which we get from outside, they have a lot of trans fatty acids in it. If you're cooking at home, it's a different story. Frequent exposure to radiation is another risk factor, especially in those people who may have had, let's say, Hodgkin's lymphoma when they were young and they were given radiation to the chest. This could be a factor associated with breast cancer at a later time. Hormone replacement therapy, yes. In all those women who are considering hormone replacement therapy or who are already on hormone replacement therapy, they must definitely go in for a clinical breast examination and a mammography before starting these pills. and they're best avoided. And they are best avoided. Because it has been seen in the West, especially US and UK, wherever the women have stopped or they decrease the intake of HRT, the incidence of breast cancer has actually come down. So we have enough evidence. Alcohol and smoking in all its form is bad. Now, a lot of people will bargain over here. Can I have 30 ml? Can I have it once a week? Can I have it twice a week? No. Now, as per the latest WHO guidelines, no amount of alcohol in any form is considered to be good or safe. And same goes for wines also. A lot of people think, red wine is good and white wine is good. We can take them. They have good amount of antioxidants. No, that is not the picture. And smoking and alcohol consumption in any form is a risk factor, not only for breast cancer, for all the NCDs. So this is ours happens to be a low resource country. So this is the guideline which is there. I'm sure everybody is already aware that breast cancer screening should start between 30 to 65 years of age. Clinical breast examination should be done once in 5 years. Now, this once in 5 years is a very long period because people do get interval cancers in between. So what is the modality we have for a country in such a situation? When mammography machines are really not available everywhere, is that a lady should be taught how to do a breast self-examination so that she can come to the doctor at the earliest. So this is what has been is under the program, that if a lady is on clinical breast examination at the level of sub-center or PHC by an A&M, if she does not have a lump, does not have any features, then she again goes into the loop of once in 5 years examination. And in case there's something positive, then evaluation has to be, the patient has to be referred to the next level. If the patient was originally at a sub-center or a PHC, that is at a CHC or a district hospital, and there an ultrasound scan is suggested. And if mammography is available, that should be done in such a case. Because the microcalcifications which are there in the breast in case of cancers are not picked up by ultrasonography, we do need a mammography machine for that. So in a nutshell, when I'm talking about awareness and when I'm talking about prevention, increase in incidence is there and it's going to increase further on. Healthy lifestyle is something which may actually help us in cutting down the risk of breast cancer. And not only breast cancer, so many other forms of non-communicable diseases also. So this is in a nutshell, and I would like to stop over here. Thank you very much for patient listening. So this is a message for all the women that they have to start looking after themselves, that they have to start taking care of themselves. And all those people who are getting to see women with, who are getting patients who are women who are more than 30 years of age, please start examining the breast. Please start telling them about breast self-examination. Start educating them so at least, they can look for the signs and they can reach a healthcare facility at the earliest. And this is the way we can make a small start towards downstaging the breast cancer. From stage 3 to 4, maybe we can get the majority of the cases in stage 1 and 2. Thank you so very much.
Thank you very much, ma'am, for such a wonderful and elaborated presentation on awareness generation regarding the breast cancer. The floor is open now for the questions. If anybody has any question, kindly put it on the chat box so that we can answer them. We can answer through our specialist on those questions. So the floor is open for raising your questions, please.
Should I see the chat box?
Yes, ma'am. You can also see, and even we are also looking from.
So, ma'am, there is a question in the Q&A box.
I think there's a key, what are the guidelines being followed in India regarding mammography, right? That is a question I can see now. This is a question from Dr. Rekha Singh. We do not have any guidelines as such under the program for mammography, but for those who can afford it and for those who it is accessible, they should get a baseline mammogram at the age of 40 years. And after that, once in every 2 years, they can get it done, provided that they are at average risk of breast cancer. But if somebody already has a high risk of breast cancer, then obviously the screening would change for them.
Thank you, ma'am. I would just like to add one thing over here. As per the NP-NCT program for the cancer screening, for the population-based screening is implied for those who are apparently healthy. So it has to be done every 5 years. So for the PBS, go for the 5 years. And if someone is suspecting something, some lump or some abnormality, then they can go for the examination, self-examination, as well as the clinical examination with the specialist.
That should be doctor's discretion then.
Yes, ma'am.
Yes, ma'am. One more question. Is it mandatory to go for biopsy if our FNAC report confirms fibroadenoma?
Usually what happens is if there is a fibroadenoma, especially if it is an ultrasound guided fibroadenoma and the age of the patient is such and the feel of the tumor is such that the doctor is sure that it is a fibroadenoma, they usually do not go for a biopsy. But if there is any doubt, then yes, one has to go in for a biopsy because that gives you a clear-cut diagnosis.
Right. Another question is, ma'am, does the risk of breast carcinoma increases in those undergoing IVF treatment?
So, I didn't get the question. I didn't hear you.
Is the risk of breast carcinoma more in the females going under the IVF treatment?
Now, this is a little, this is a gray area. We do not have any clear-cut literature on this. They are taking a high amount of hormones. So maybe at a later stage, they could be at a higher risk, but then we do not have any conclusive literature on this. Which diet is the best for breast cancer? So if we have to look at the diet, it will be a diet which has
I think we lost you, ma'am. She connected.
I think, ma'am, there is a bandwidth issue with our expert.
There is some technical issue. If you question in the chat box, we will try to answer all those questions. And now, as we are running short of time, we may close the session. So for that, I invite Dr. Ramesh Agarwal to kindly give the closing remarks.
Yeah, thank you very much for joining, for all of you joining for this informative and interactive webinar. And we hope that you will be joining the same webinar series which has been initiated by our NP-NCT program. And the next in this series will be on 20th of August. and it will be on oral cancer. So we will be covering the cancers in this webinar series, and I hope you have enjoyed this session. And you can put your queries, as Dr. Shikha has said, in the chat box, and the PPT will surely be shared. So we can close this session, Dr. Vinash? Okay. Thank you very much.
Thank you very much.